Discussion today, being the Cancer Awareness Month, is the fight against cancer. And I have guests in studio, Honorable Beth Mugo, nominated senator and cancer survivor as well. And we have Rachel Kitonyo, who's a board member, Kenya Cancer Association. Thank you so much for making time for us. Honorable, I'll start with you. There's so many things that people do not know about cancer, but you are a survivor. How was your journey?
Well, good morning, viewers. I'm delighted to be here at the Nation Center and to share with the viewers my personal experiences and also what I think is the way forward. You know, in 2011, I was then the Minister of Public Health.
Yeah.
And on my routine, a checkup, I didn't go for mammogram about April or March. And I went on normal checkup, but I was feeling like I was feeling a lump. But the mammogram missed it completely. Yeah. They told me, no, there's nothing. And then about October, November, I was coming from Brazil for a conference of health ministers. And that day also was very heavy. I arrived in the morning, was heavy in Parliament. Yeah. That's when we had difficult questions to do with maize, safety. And as I was going home in the evening, I felt like I felt sick. And I called my doctor. I stopped at the hospital at Mpisha. And my doctor said, no, let's meet you at the Nairobi hospital where he practices, Dr. Madengi. And when I got there, he checked everything. He's a cardiologist. Yeah. And he found that there was a little veins, capillary somewhere, which had blocked. And that's why I felt a bit sick. And he explained to me nothing to worry about this because it's like a little road in Kirisha which is blocked. Yeah. And traffic in Nairobi
is heavy everywhere.
It's moving, yeah. Which I thought was very interesting. But he said, now that you're here, Minister, I've been trying to get you to do my full yearly tests, which are medical tests, which I do. And he said, now that you're here, he had already admitted me, we are going to do that. So that's how we started. And when we came to mammogram, after all the other tests, I said, no, I'm not doing mammogram. It's too much radiation. I just did one in March. He said, in that case, I still want to check everything since you're having your yearly tests. And he did the blood works. And then he said, we do anyway, not the mammogram now. Yeah. He said we do the other test, which I don't remember now the actual title, which he did. And that's the one that found that there was a lump on my breast. But they did not confirm it's breast cancer at that stage. The doctor who was doing that, he said to me, I will not do a fine needle test, which is, they call it FNA, yeah, unless you're going to have your treatment if it is cancer. He said it can be a lump, but a lump does not mean it's cancer all the time. So he asked me where I would like to be treated. I had a friend who had gone through breast cancer, a wife of another doctor, a doctor in America, 15 years before, and had come out very well. So I said I would like to do it in America. So he said, that's where you will do the final test to ascertain whether it's really cancer. So I had meetings coming up. We were taking over the leadership of the ministers of health for East, Central, and Southern Africa. And I'm the one who was taking over in 2 weeks' time. So I was divided. Do I rush enough to go to America and about all this? I said, no, I will do my duties first. I will go do this conference in Mombasa of these ministers, And after that, I left the very next day after we finished that. And my friends there had organized for me with the doctors who were going to take care of me. And they received it in Philadelphia, University of Philadelphia clinic. And that's where now they did FNA, which confirmed, yes, it is cancer.
Okay.
Although I've been having nagging, actually I had stopped thinking about it, but whenever I thought about it, I wondered, is it really cancer? I would say no. I was in denial. So when then the doctor checked and said, yes, it is cancer. Now they suggested to me the ways of treatment and for me to choose which one I want to do. And I chose a major, which involved also a major operation. Although I had a lump on this breast, one breast, which was really first stage, just almost going to second stage, but first stage, because they checked the other arm, the glands. That's where breast cancer moves first, if it moves anywhere. And it was clear. So they told me it has not progressed anywhere.
So at least this was found early?
It was found very early.
Okay.
And I was lucky that way.
Okay. Let me bring in Rachel here. Rachel, and from the perspective of a board member from the Cancer Association, how then do you detect this early? Because most patients that we've spoken to sometimes tell us that I was just feeling fine. Because I didn't feel any pain, I was just okay.
Normally by the time a cancer is paining, that's too late. So what we normally encourage women to do is called breast self-examination. And so once a month, about probably 6 to 7 days after your period, you're supposed to feel your breasts.
Once every month?
Once every month, at the same time every month, so that you can notice any changes. And so if you do it regularly, you'll get to know the regular how your breast normally feels. And we say 6 to 7 days after the period, because periods do change how the breasts feel. They tend to get a bit fuller. And so if you've been doing it regularly, the time you feel something different, then now you would go to the hospital and a nurse would do what is called a clinical breast examination. So every woman needs to do the self-breast examination at home. You just lie down and you feel the breasts, all the 4 quarters of the breast, both sides, same time every month. So that the minute you feel a change, something is not right, go to the hospital. You'd rather go and be told there's nothing than, unlike Meshimiwa, who delayed a bit. I know I'm not feeling quite right, but I don't want to think it's that. Better just go then and be told it's not anything than to sit at home in denial. So if you do the regular self-breast examination, you would probably catch a lump when it's forming, which means would probably catch it in stage 1. Hopefully would also catch it in stage 2. Now, by the time a breast is paining, by the time the other symptoms are things like the breast is leaking, so you've got pus coming out, or there's an inverted nipple, or there's now a really big lump, then by then it's late. And so breast cancer treatment is most successful when caught in stage 1 and stage 2. When we catch it in stage 3 and stage 4, which unfortunately is where we catch a lot of Kenyan women, the prognosis is not that good. So part of the reason we are losing so many, and breast cancer is now the #1 killer of women in Kenya. We are losing about 6,000 women a year. So all of that is because of late detection, and it's one of the easiest to catch early simply because of just feeling. And so my message to all women is feel. Surprisingly, even husbands can help with the feeling. I mean, I've had several women who say, my husband discovered the lump. I didn't know there was anything. And then one day he touched and said, I feel something. So once a month, 6 days after the period, same date every month, just feel. That's the easiest way to catch it.
Let me just add to that, the name I couldn't remember is ultrasound. It's very important if you really suspect something, if you miss it with mammogram. And let me say, even US, they do miss with a mammogram. It doesn't mean it's just our mammogram, And you're suspecting, like I was, because I had felt like I felt a lump. But I wasn't sure, because it was so small still. A mammogram is the one that detected my small lump at stage 1. just before going to stage 2, because they measure with the centimeter. But to tell Rachel, I only was suspected in November, and I went to the States in December. So it was really just 1 month, because I wanted to finish this meeting, which included the whole region. But I also give the same message: don't wait.
Yeah.
If you suspect, I had no pain, not from the cancer, not from the lump. The little pain I had felt, which saved my life maybe, was that little capilla for the cardiography now, blockage. And that's what made me maybe go to the hospital at that time. But it was time to do my yearly tests. And I want to encourage also our people, especially women and men, to do their yearly medical tests. It saves a lot. It's much cheaper than developing a disease, and then you're going now to go through that. And to take the national insurance, NSIF, because it can cover all those expenses. One does not have to say they don't have the money to do it.
Yeah, no, but I'd like to come to you on that, because in 2011, you were the Minister for Public Health. In hindsight, what do you think the government should have done better? Because at least you had the chance to travel to the US. Many women do not have that chance.
That's true.
But before we get into that conversation, Bernardo Juang is joining us from Migori, I believe, where he's also speaking to some residents there concerning the Cancer Awareness Month and whether they know what they should do for early detection. Like we've just been informed by Rachel Kitonyo that self-examination could help save your life. Bernard, good morning.
Well, thank you very much, Trevor. We are here in Rongo town. Despite the campaigns and efforts of the government fighting cancer here in the country, the situation is still on the rise. And now we are in Rongo town. We'll be talking to some of the locals here. Just tell us what they know about cancer. Join me here. Okay, what do you know about cancer?
We know cancer is becoming a threat in Kenya nowadays. Hapo awali tulikuwa tunajua cancer ilikuwa inashika tu wale wadosi, wale wako na pesa. Lakini siku hizi imefika wakati hata ukiona kwa maboma za wale maskini wanakuwa na cancer kwa safari mingi sana. Sasa cancer mara mingi watu huwa hawaendangi hata kwa check up. Sababu zingine uko na mali kidogo na cancer, saa hii ukienda hata kwa check up upatikane uko na cancer, ni kama ni ile kitu imekuja inamaliza mali kwa boma, mpaka hata watu sasa wamekaa na hofu sana juu ya cancer.
Nini inachangia watu wasiende check up?
Sasa unapata kama safari mingi ukienda kwa check up mara ya kwanza ya pili utaambiwa eti uko na dalili ya cancer. Hata ukienda upatikana uko na dalili ya cancer, watakwambia mara utatibiwa, utapelekwa mara biopsy, unapelekwa kwa hospitali, na za zingine unaweza tumia pesa mingi sana, na baadaye watu huwa upotezanga maisha yao kupitanga cancer.
Unaona suluhisho ni nini serikali inafaa wafanye ili angalau iwasaidie wananchi wa Kenya kuhusiana na huu ugonjwa wa cancer?
Sasa kwa sahi sisi kama wakaaji wa Kenya hapa, wananchi wa Kenya, sasa ni serikali inafaa afanye kampeni kabisa kuhusu hii mambo ya cancer. Kila mtu aende kwa hospitali mapema, ajue hali yake kuhusu hii mambo ya ugonjwa wa cancer. Juu ukienda ikienda sana, muda ikienda sana ipatikana, kuna stages cancer inapitanga. Kama bado iko kwa hali stage, nadhani ukienda hospitali mapema unaweza saidiwa mahali.
Asante sana. Tutazungumza, we'll talk to another person here. Habari yako? Hii mambo ya cancer, kila mara tunasikia watu wanapoteza maisha yao kutokana na cancer. Je, unajua unaelewa nini kuhusiana na cancer?
Mimi naelewa cancer ni vile tu hatujapata hospitali mzuri yenye inatibu hiyo ugonjwa ya cancer. Mimi naweza sema serikali ikiwezekana tupate madaktari kutoka nje wenye watasaidia sisi kwa kuangalia hiyo ugonjwa wa cancer.
Je, wewe mwenyewe ushaenda check up ujue hali yako?
Bado sijaenda mimi. Yeah.
Na unatarajia kuenda kujua hali yako maybe kama uko na kansa?
Natarajia kuenda kwa sababu vile nasikia hiyo ugonjwa hata ni mbaya sana. Natarajia kuenda ni ajue hali yangu iko namna gani.
Je, unaona serikali inaweza fanya nini kuwasaidia wananchi kutokana na hii mambo na ili kuwasaidia kutopata kansa?
Mimi naona serikali kama inawezekana madaktari yetu wakuwe wakienda masomo zaidi hiyo ya kansa ili tukuwe na madaktari yenye wataweza. Yeah.
Well, I'll talk to another person. Habari yako mzee?
Mzuri.
Hii mambo ya kansa.
Hii mambo ya kansa, mimi ni Jona Yalo kutoka hapa Rongo. In fact, mambo ya kansa amekisumbua watu sana kwa muda mrefu. Ni ugonjwa ile zamani tulikuwa tunasikia tukiwa tuko mbali. Hii kanti hii yetu sisi tumekosa vitu vingi. Hakuna maji mzuri tuchimbiwa wells. Mtu akwae na maji mzuri na check up ya dawa. Chakula pia hakuna. Tunatakiwa government aingie sisi tupewe nini? Tupewe nafasi ya kilimo, tulime ile chakula ile taweza kuongeza watu mwili nguvu.
Je, wewe mwenyewe ushaenda kupimwa ujue hali yako kama uko na kansa?
Mimi bahati yangu mzuri nimepimwa napatikana sijakuwa na kansa, sipokuwa mimi nafikiria watu wengine wapimwe, maana yake mimi najua hali ile inaleta tabu ni kukosa chakula na kukuwa na mambo mengi ya mafikiro. Saa nyingine ni njaa na mambo mengine.
Well, asante sana. Okay, wewe mambo na kansa, wewe ushaenda kupimwa ujue hali yako iwapo kama uko na kansa?
Mimi mwenyewe nimepimwa tayari, nimejua hali yangu, hata hali ya watoto wangu mimi najua vizuri. Wamepimwa vizuri, najua hali hao. Hii ugonjwa nayo imezorokta Kenya hii, lakini si mbaya sana. Serikali ndio wanaregea, lakini wasiregee sana.
Nini nafuta hiyo? Inasemekana vyakula ambavyo pengine mnakula ndio inachangia.
Ni si chakula mbaya, ni ile chakula ya China ndio imekuja hapa Kenya mingi, ndio imesababisha hii maneno. Unajua hata hizi spices watu wanakula sana, ukienda kwa hoteli ukula hizi spices ndio inaleta hiyo ugonjwa.
Well, thank you very much. Habari yako? Trevor, you've just heard from some of the residents here in Rongo town. They are saying that most of them, they are still not aware about their status, cancer status. Some of them, they are saying that because of poverty is keeping them away from going at least to check, going to the hospital. They are saying that sometimes they are not informed. Sometimes they are saying they think that it is quite expensive to know their cancer status. But they are also appealing to the government, maybe to the county government, at least to come up with the idea, with maybe a program talking to locals in the rural areas so as to know the benefits of going for checkups and know their status. Back to you, Trevor.
Thanks, Bernard. That's Bernard Onjuang speaking to us from Rongo with a quick crossfire to the residents there. And Honorable, you've heard what they said. The first thing that comes to them is expenses. And in 2011, you're the Minister for Public Health, but you still opted to go to Philadelphia in the USA. What about the people who can't travel?
I hear you, and I believe that is an issue that we have to sort out, and the government is putting a lot of effort. What we did then, remember we were both with Anyang' Nyong'o and we both got cancer. Maybe it was a wake-up call. Anyang' Nyong'o was also Minister for Medical Services. And what I did as a Minister of Public Health, I introduced an act in Parliament, an act for prevention and control of cancer, and of course, early detection and treatment, and also a strategy, cancer strategy up to 2016, which we now have passed. I'm sure the minister who is there now, they have added to that strategy. In this strategy, we had identified areas where we need to focus a lot. And most of it was really on screening, because as Rachel has said, if cancer is detected early, the chances of healing are very high. If it's detected late, it's almost a gone case. And that's what we try to do, and there are many efforts. Let me say, what I would like to see really happen in the government is a lot of education, a lot of information on prevention and reducing deaths by cancer. And that is a lot of education and information and a lot of screening. And I want to say now there are many, not just the government, individuals, organizations, NGOs, who are engaging in cancer screening and information. The Beth Mugo, we also, out of my experiences, I spearheaded establishment of a foundation, the Beth Mugo Cancer Foundation, and we have so far screened over 9,000 women, going to 10,000.
Is this free of charge?
Free of charge. Yeah. The last one we were in Machakos County, where we screened, I think, about 1,000 something. We screened in Dagoretti, of course, that's where I started. We screened at KICC. And for this Cancer Month, we are also doing, we were going to do one screening in Meru. It looks like it's getting a bit late because we contact the county government. We do it with the county government. But we have a mobile clinic, which we move there, and whatever medical, what is needed, doctors, nurses, we go with those. But we like to have also the county because they are the owners of the screening of health. Something else I would like to see happen, instead of leaving this big, gigantic responsibility to counties, because some counties do not have the capacity, and I think all the counties really don't have the capacity, because this cancer has become like an epidemic now. I would like to see the health docket, even though devolved, and I had suggested this even when I was minister, to have both governments, both the levels of government, the national and the county involved, especially in prevention. Not only cancer, even other difficult diseases like cholera, where areas which we know are really very difficult for counties to manage by themselves. I hope that is something that can be agreed by the both levels of government. For prevention, I think the national government would do better. We need more equipment. We need more doctors and technical workers. We need more equipment. We need our technicians to be trained to handle this, because cancer area, those areas are a bit difficult from just the normal, different training. And most of all, we need a PET scan in this country. There is no PET scan either in the private hospitals or even our hospitals. The PET scan is the one that shows if you are diagnosed, like I had breast cancer, is it the only place? Is this cancer coming from somewhere else? Or is this the original? And that's the first test I was given when I got to the US after FNA. They needed to know so that they know they are treating, they are what they are treating. Sometimes the cancer has moved, then the breast is removed, or whatever treatment of prostate or cervical, those are the areas mainly we deal in. Kube, this is coming from somewhere else, or it has already moved somewhere else. So after a short time, then it springs up in another area. And I understand from doctors, the secondary stage is even more difficult to treat than the original. So if the government could put resources together and get a PET scan at Kenyatta National Hospital at least, those who, because it's difficult to put in every hospital. South India, the whole India, southern India, which even starts from Delhi, they were telling me in Delhi, is the only hospital that has that PET scan. That very modern one was in New Delhi, Apollo. So even if we don't get that very high, the newest, let's get a PET scan And I think that could prevent
Something
a
we can
lot
work
of
with for
deaths.
now. Okay.
Yes.
Rachel, one of the other things that the viewers who were speaking to Bernard brought up was they were saying that they used to think this is a disease for the rich and the expenses is too high up there. And we've seen a lot of cancer cases lately. Is it that it's on the rise, or have we gotten better at detecting it now?
I think it's both. So it is on the rise because several things have changed in Kenyan society. So if you look at, when we talk about prevention, the preventable things, so say for example food, our dietary patterns have changed. So part of the change is that you've got a lot of chemicals in the food supply. So even foods that we think are healthy, so say you take your average sukuma wiki, depending on where it's grown. So if it's unfortunately grown in Ruai, it has been watered with sewage. So sukuma wiki is a healthy food, but then it will come laced with chemicals from the water that has been used to water it. Things like aflatoxin in maize. And so when you've got, I come from Ukambani, we have got a lot of cases of aflatoxin because the maize is stored and then it gets contaminated with water, which allows the mold to grow. So just generally, there are changes in our food patterns. And so even some of the foods that we think are healthy are contaminated. Before then, of course, you add the fact that things like fast food are increasing, processed foods are increasing. When I was growing up, we ate sausages at Christmas, because that's the only time my mother could afford it. Now the average middle-class household, children eat sausage once a week, and processed meat every morning in some houses. And so that processed meat, so beef, when it's beef, is healthy. When it's converted into sausage, bacon, you know, it's not healthy. And so there have been changes in food. There are changes in exercise patterns. So we are getting children who are more and more sedentary because there are no playgrounds. We've got adults who are sedentary because they spend their time in traffic and then they're at work and then they're seated all the time. You have got, when you spend 2 hours in traffic, what are you breathing in through the exhaust? You've got sometimes our water is polluted. So there are a whole range of things in our environment that are not right, and therefore they are affecting our bodies and affecting the cells, because cancer starts in the cells when they start mutating. So there is that, which is contributing to the increase. But then also I think because we are also doing more awareness and more people are going for checking. So it's a combination of a bad environment and more technology. But I wanted to touch on one thing that she raised, which is the policy that was passed by the government, which was the Cancer Act, I think 2011, 2012.
Yeah, was the
when she was a minister. And from an NGO perspective, the problem we have with that policy is that it's a very good policy, it covers everything, but then it was not funded. And so it's a piece of paper that has got no teeth. And so one of the things that it set up was the National Cancer Institute that had the mandate to deal with both prevention and early detection, because it's always easier to catch the disease early. And then you give what is called a National Cancer Institute 10 million. What can they do with that in a country of 50 million? So if you divide 10 million by 50 million, how much were they allocating per Kenyan? And so it was a very good document, but because of the lack of funding and the lack of investment, so both in that institute and then in the broader health infrastructure. And so this new bill that Honorable Waruguru is bringing, the Laikipia Women Rep, and really what she's addressing is the funding issue. Because without adequate funds for infrastructure, and so as she explained, there are 3 kinds of cancer treatment, and some of them are very expensive, so they can't be put everywhere. So at the most basic is surgery, which is removing out the lump. And I believe if government was dedicated, you could actually get surgery happening in most level 5, level 4 hospitals.
If government was dedicated, you don't think they are dedicated enough?
Not yet enough. So that is possible to have in level 5 and level 4, because we already have surgeons who know how to operate. Then the second level becomes chemotherapy. And for chemotherapy, you need trained personnel, because these are drugs, and chemo drugs can be very toxic. And so at that level, you're looking at training nurses to be able to administer it. And so when she talked about the lack of personnel, government recently, you remember when they bought all this equipment? It's one thing to buy equipment, it's another to have the people to operate the equipment. And so if you don't also look at the personnel element of it, which is sufficient training to get enough manpower to operate these things that we have bought, then they will sit there gathering dust. And so for chemotherapy, I am aware there are some counties that are now setting up chemotherapy. So previously it was only Kenyatta and Eldoret, Moi Teaching and Referral. But would they also face the same challenge? Who's going to operate the machines? No, so they had staff. Now the problem was these are only 2 places in Kenya for 50 million people. So the other day Nakuru opened up a chemotherapy unit, because you just need to train the nurses. So again, my belief is that at level 5 and level 4, you can also train nurses.
Okay.
Now, what she talked about, things like PET scans, radiotherapy, those are extremely expensive. So you can't have that everywhere, which is why we have no PET scan, and that's why she's calling, can we at least have one at Kenyatta?
Yeah.
And then radiotherapy in public hospitals is only at Kenyatta. And so a radiotherapy machine is extremely expensive. I think we're looking at about $500 million. So how many counties can spend that kind of money? I think for me, my suggestion to the ministry, which I think they already had the plan for, was to have maybe 4 or 5 regional centers. And so if you already have Nairobi, you have got Eldoret, you added Mombasa, you added Nyeri, and you added maybe Kisumu or Kisii. So that you cover the regions. Then that way you'd be able to buy 5 radiotherapy machines, because I mean, it's ridiculous. You do screening in Meru, the person goes to level 5, they get the breast operated out, they potentially can get their chemotherapy, and then when radiotherapy is ordered, they travel to Nairobi. So if you had, even if you're in Meru and you had to travel to the nearest place, if you had just those 4 or 5 radiotherapy machines, public hospitals in the country, you would avoid that coming, because the expenses are not just a treatment, is if you have to travel to Nairobi, you spend the night sleeping somewhere. What if you're on the queue at Kenyatta, you're not dealt with today, you sleep tomorrow? I mean, where are you spending? Who's buying that food? And all of that will not be covered by NHIS.
There's a domino effect.
So the expenses are not just treatment, it's everything else around you, whether you'll have to come with a caregiver. And so when I say the government is not serious, they were serious in enacting the policy, and for that we thank Honorable here.
But they haven't
But they have not been serious in ensuring there's enough infrastructure. So they've left counties to try and do it on their own. But as I said, there's no county that can afford a radiotherapy machine, and there's definitely no county that can afford a PET.
Honorable, I'll come to get your thoughts on that in just a bit. But for now that we're speaking about treatment, let's try and find out if we have alternative treatments. And I'm crossing over to Eldoret, where Lois Wangoi is standing by. Lois?
Many thanks, Trevor, and we continue with that conversation. And as I noted earlier, I have a herbalist in studio here in Eldoret to discuss the role of alternative medicine in the treatment and management of cancer in the country. Thank you, Bwana Shadrach Mehmet, for joining us. We start with the very basic question that every person would ask you. Many people seem not to appreciate alternative medicine, and there's a lot of bashment, especially from the conventional treatment, saying alternative medicine at times offers hope that does not go to treat and manage certain diseases. And with this particular topic, cancer, what do you have to say about that criticism?
I think we are doing very good work, because we can't be cheating people every day and they come to our clinics. Even in the Bible, in Ezekiel 47 verse 12, the fruit of the tree for your food and the leaves for your medicine. So I fail to understand why people take us as wicked, as people who cheat and so on. And you see internationally, other countries appreciate their herbalists, or they call them natural health workers. And we do that. So I think it is high time we go from that criticism. Yes.
And this alternative medicine, is it effective in the fight and management of cancer?
Alternative medicine is very effective in prevention and treatment of cancer. Because, first of all, these herbal medicine are minerals, vitamins, nutrients. And when you take them, they improve the health of that patient, or even if you are not a patient, it makes your body to be able to have a very strong defense mechanism, which can be able to combat cancer and other diseases.
Do you have a case study for a patient who came in? If you could talk to us about that, what type of cancer did they have, at what stage was it, and how did you manage it?
I have several, because I've been in this field for over 20 years. From when I was a very young boy. So I have a lot of cases, but I can talk about one case whereby someone was to be operated because she had a mass in the uterus. And after coming to our clinic...
A cancerous one?
Yeah, a cancerous one. And after coming from to our clinic, after she was told that if it is not operated on, she could not even live for two months or 3 months. Now, I think it is about 10 years ago. So, with that case, another cases whereby another patient also was
Are you still managing her? Is she still on treatment?
No, she's now okay. She's not coming again. But when we meet in the streets, she's very healthy. We have another case where someone had gone to UK for chemotherapy after Kenya medical hospitals had given up. And in UK, she was told that her case was very bad. She could not live even for 4 months. And now, I think it is now 15 years ago, doing very well.
Now, I want to understand, when it comes to alternative medicine, you agree on certain issues regarding cancer with conventional treatment. You agree that early diagnosis is good, prevention is also good, and a healthy lifestyle is also very, very key in the fight against cancer. So at what point do you differ with conventional medicine?
We differ when, for example, when conventional doctors say that herbal medicine are not good, they are not tested, they are poisonous and so on. And also we tend to say even theirs, it is in the public domain, it is all over the internet and so on, that chemotherapy is toxic. So how can you treat a very sick person with something toxic? You should use something which improves the state of health of that patient. In preventive.
So what is your approach? Because we know when it comes to conventional medicine, you have chemotherapy, radiotherapy, or even the two combined together, and surgery, of course.
Yes.
So what approach do you use in alternative medicine?
First.
And how does it work?
Yeah, it works because first, you should know that cancer. What is it? Is it cancer of the cervix or whatever? And then you use, first you advise on the kind of food, because if you know how to treat cancer, you have to know what causes it also, what caused it. Because you can't treat someone and leave her or him to continue with the lifestyle, because this is a lifestyle disease. So you have to counsel her on what to eat, because most people don't eat vegetable, fruits, fiber food, something with fiber and so on. And then after that, now I give something which goes to fight the cancer, something to help the immunity to be able to defend itself, something that goes to the body and make the body to repair itself, to rejuvenate. And when the body can be able to rejuvenate itself, if it was a tumor, the body now start making new cells to fight the bad cells or cancerous cells.
So you treat with pills, no surgeries?
No surgery, we don't use surgery, we use herbal medicine. For example, there's an herb which is all over, it's called dadelium, which when you take that kind of herb, it is very effective in cancer treatment. And we have been using it for over 20 years, and I see very much improvement on patients, and also patients referring people themselves to our clinic. Yes.
And how do you, I don't know whether to use the word verify, or how do you maintain checks and balances within the alternative medicine setup? Because we understand if you have your own clinic, then you pretty much come up with your own treatment.
Yes, yes.
So do you agree, do you have a sit down where you agree as herbalists that, for instance, you've mentioned a herb?
A herb, like dadelium, for example.
Yes. Do you sit and agree? Do you research together? How do you maintain checks and balances?
Yeah, in this country, we don't have a very effective body for herbalists. We have it, we have one, but it's not that effective. So there is no, we don't get to know each other and even to sit together and do that. Everybody does for he or himself.
And my question would be, if I'm herbalist A and you're herbalist B, if let's say we are managing ovarian cancer, for instance, the herb, if I'm using herb W, if the same patient comes to you, will you be still using herb W?
No, no.
So how does that work? Because in conventional medicine, if I have malaria and I go to hospital, the medicine that I'll get at my teaching and referral hospital is pretty much the medicine I will get at a Nairobi hospital after diagnosis. So how does that work? How come you have different treatments within alternative medicine?
No, everybody has a background. Like for myself, I stayed with a grandmother who was practicing this kind of treatment. And from that background, I have come also to be able to, through experience, to know if you mix herb A and herb C, the other one will be working for cancer, the other one will be working for, if it is a tumor, the other one will be working for the immune system. So I do it, we do it as has, not as herbalists. If, for example, my clinic, I do that way. And I have people who are employed and they do the same way I do, but not, I cannot talk on behalf of another herbalist whom I don't know what he's giving out.
Okay. Yeah. And do you borrow from conventional practices when it comes to the treatment and management of cancer? No. I do it, we don't do together because them first, they overlook us, that we don't know anything, you're not educated and so on. So everybody does according to the way they do. Can they complement each other?
Yes, we can. If there is a harmonized way of whereby we can harmonize the conventional medicine, because I know conventional medicine, like for example radiotherapy, for a cancer, for example, a cancer of the throat, or a tumor of the throat, whereby someone is not putting in anything, it is blocked, the esophagus is blocked, and they use a radiation. So that tumor will now shrink.
There are times where you can refer your patient, first of all, go get radiation, then come back.
Even for there is a pipe which is used so that the patient can be able to eat. And after that, they do the radiation and so on. And then they come to our clinic and they continue with the treatment, because herbal medicine is slow but sure. It is, it will not work for emergencies, for example. That is where we can harmonize and make sure that when it is an emergency, you just advise the patient to go to hospital. But when it is something to be managed for a long time, even the doctor should be referring them to and we have some doctors who tell the patient, instead of this surgery, try herbal medicine. And they come to our clinic and they become better.
And as we wind up, Bwana Shadrach Moimet, tell us what sort of clientele do you have when it comes to alternative medicine? Have you seen a trend where now even the affluent in society are opting for herbal medicine, or is it those who seem not to afford the very expensive treatment, say those who cannot even travel abroad for further treatment, who come to seek alternative medicine? Who are your clients?
My clients are across the board. You have those people who are very rich, who have gone to outside the country. They have been drained by those the treatment, and they don't have any money. They come. Some even knows, like in our community, they know that some people know that herbal medicine is the way to go. So they come even if they are rich. And we have a lot of people who don't afford those the medicine in conventional setup, and they just prefer herbal medicine direct. So we deal with across the board, the rich, the poor, the middle class, and so we have them all.
And I want to imagine you appreciate the role of research, whether it's in alternative or in the conventional setup. So how do you better yourself? How do you ensure that research is done, and how do you ensure that you're up to tabs?
Yeah,
very briefly as we wind up.
Yeah, sometimes even we go for we take our medicine for research. For example, I take my medicine to Kenyatta University, whereby they research and
give you feedback.
Give me feedback that it is working for a tumor and so on. So I'm very updated.
Okay, so you keep tabs with changes.
Yeah.
Thank you very much, Mr. Shadrach Mwimet, a herbalist from here in the county of Uasin Gishu, talking to us on the role that alternative medicine plays in the treatment and management of cancer. Now, NTV Today takes a short break. Don't go far. My colleague Trevor Ombija will return with much more, but that should be it from us here in Uasin Gishu County.
Thanks for staying with us. Before we cross over to the ad hoc Senate committee where Mwangi Kiunjuri, the CS for Agriculture, is currently being grilled over the maize scandal, let me just get my final remarks here from my guest. We were speaking about the cancer, battle against cancer, and this is the Cancer Awareness Month. Beth Mugo is still with me, nominated Senator and cancer survivor, and Rachel Kitonyo, board member, Kenya Cancer Association. And Honorable, I'll start with you. Lois was speaking about alternative treatment and maybe your advice to Kenyans going forward.
I think it's okay to consult to go to try alternative medicine, but make sure you mix it also with the professional, with the conventional medicine, so that the doctors can monitor you. Are you really getting better from this, or you are not?
Okay.
Because I believe when we had these treatments in our grandmother days or grandfather days, the kind of diseases we have now are different. The cancers were not there and so forth. So we still need conventional. When I was minister, we invited the herbal medicine practitioners to work with KEMRI, you know, the Kenya Medical Research Center, for institutes, for trying to see the kind of medicine, for research. And I think if they could work together, we're not isolated, they could be of use.
Okay.
But on the cost side, I want you to ask Kenyans to really take insurance, which is available now, the Kenya National Health Insurance, and it's reachable.
Okay.
As the government have subsidized it, and it can help you to get treatment for cancer. I also want to add that the government must really look further now into food safety.
Okay.
There's so many chemicals put in the food.
The food industry.
Even the fruits, we hear that they're putting medicine to make it ripen quickly. In the GMOs. Everything, unless we check all these areas. And for the girls, stop going to River Road to get those makeups to lighten your skin, because a lot of those chemicals, they contribute to cancer and what we eat.
All right. Sorry to rush you. Very briefly, just for 5 seconds.
I would say that I liked the fact that he's having his medicines tested. There's actually a new law the government has passed that allows the herbal treatments to go for verification. And so that then you can get what are the ingredients and what are the what they call active ingredients. So what is the thing that causes the treatment?
And advice to the people.
And so if you're going to use any herbal medicine, make sure your practitioner has taken the things for testing. At the level of the individual, know your body. So for breast cancer, it's the breast self-examination. Generally, know how your body feels when it's healthy, so that you know when it's not. So self-awareness is very important. And then for the government, it's 2 messages. You need to increase the investment in cancer treatment. And secondly, one big thing they could do to bring down the cost of treatment is zero-rate chemotherapy drugs. Remove the 16% VAT, and the cost of medicine will come down.